Hello, and welcome to our panel discussion on erythropoietic protoporphyria, EPP, phototoxic, light-triggered reactions, and systemic complications associated with accumulation of PP9. This video program is sponsored by Disc Medicine. The speakers are not employees of Disc Medicine, but have been retained to present on Disc Medicine's behalf. Today's speakers are Dr. Bruce Wang and Dr. Gail Ross. I'll let each of today's speakers introduce themselves. And Dr. Wang, let's start with you.
Hi, Josh. I'm Bruce Wayne. I'm a hepatologist and associate professor of medicine at the University of California, San Francisco, with a focus on inherited liver diseases. I run the UCSF Porphyria Center, which is the main referral center for patients with porphyria on the West Coast of the United States, and I run a research laboratory studying basic liver biology. I'm an active member of the NIH-sponsored Porphyrias Consortium, and I'm also a member of the American Porphyrias Expert Collaborative, serving on its board of directors. I have been a principal investigator on several clinical trials in porphyria, including the Aurora trial.
And I'm Gail Ross. I'm a dermatologist and an associate professor of dermatology at the University of Melbourne in Melbourne, Australia. I specialise in porphyria and I run the Porphyria Expert Centre at Royal Melbourne Hospital, which is the main referral centre for porphyrias in Australia. I've been an active investigator in multiple porphyria trials over the years, including the Beacon trial, and have published widely in this area.
Doctors, a pleasure to have you both with us. Thank you for joining us, and we're looking forward to learning more about the cause and impact of this rare disease, as well as hearing more about your experiences with EPP. Now, we should note that this video program is split into 3 video chapters. Chapter 1, Illuminating PP9, the cause of phototoxicity and systemic complications in EPP-XLP. Chapter 2, Understanding patient health and psychosocial burdens of EPP. And Chapter 3, Advancing care for patients with EPP. In this final chapter of this series, Advancing Care for Patients with EPP, we'll review the comprehensive care plan for patients with EPP, focusing on current management guidelines, including lifestyle adaptations, post-diagnosis monitoring, patient counseling. So let's start by highlighting the latest consensus guidelines for managing EPP. Dr. Ross, can you walk us through the 2023 dermatology-focused guidelines?
Sure. These guidelines, which were published in the Journal of the American Academy of Dermatology, focus on diagnosing, treating, and managing both EPP and XLP. They were developed by porphyria experts from the Rare Diseases Clinical Research Network's Porphyria Consortium, supported by the NIH. The recommendations are based on a thorough literature review.
And Dr. Wang, I'm seeing there's a more recent guideline published in 2024 in hepatology. So how do they differ?
Yeah, so the 2024 guidelines are focused specifically on liver-related dysfunction in EPP and XLP. It provides recommendations for diagnosis, monitoring, and treatment of liver complications, again, developed by experts from the NIH's Porphyrias Consortium.
So let me ask you both, how do these 2 guidelines complement each other in clinical practice?
They work together seamlessly. The 2023 guidelines cover overall disease management, while the 2024 guidelines give us a framework for addressing the liver complications, which can be a serious issue in some patients.
And so now that we have an understanding of the guidelines, let's dive a little deeper into the available management strategies for EPP. Dr. Ross?
Sun avoidance is crucial for patients with EPP, since even minimal sun exposure can cause severe pain. We recommend protective clothing with the ultraviolet protection factor, or UPF, broad-brimmed hats, and specialized sunscreens which block visible light. This is really important because traditional sunscreens will only block UVA and UVB, whereas the wavelengths causing porphyria symptoms are wavelengths in the visible blue light spectrum of 400 to 410 nanometers. And this is not typically well covered by your ordinary sunscreen. So some patients will notice mild improvement with an opaque zinc-based sunscreen, but in fact, a tinted sunscreen tends to be more effective at blocking that visible violet light.
So what is the recommended monitoring for patients with EPP that clinicians should be aware of?
Annual lab work is essential for tracking disease progression and preventing complications. The key tests include erythrocyte protoporphyrin levels, a CBC and iron panel, vitamin D levels, and liver biochemistry. Given the risk of liver dysfunction, we also would recommend liver imaging from time to time.
So it sounds like a multidisciplinary approach is key here. Where should clinicians turn if they need further guidance?
The consensus guidelines serve as an excellent reference, and peer-to-peer consultations with porphyria experts can help with complex cases.
So managing phototoxicity is key for EPP, and this slide summarizes strategies from recommended to not helpful. Dr. Ross, what's crucial to emphasize?
As I mentioned before, sunlight avoidance, opaque clothing, broad spectrum sunscreens, and window tinting are recommended by the consensus guidelines.
And conversely, what is not recommended?
So cold compresses can be of benefit for some patients, but not everybody. But it's important to call out what is not helpful. So painkillers such as paracetamol, non-steroidal anti-inflammatories, antihistamines, and corticosteroids are not useful.
The yearling monitoring is key. Dr. Wang, what are the core tests that we need to remember?
So yearly protoporphyrin levels, and remember these should be checked from within erythrocytes or red blood cells. A complete blood count, a liver panel, and iron studies are also crucial. Because of how common vitamin D deficiency is in patients with EPP, vitamin D levels should be checked annually and they should be supplemented accordingly.
So when is iron supplementation appropriate?
So iron supplementation really is only recommended when the hemoglobin levels are low and the ferritin levels are low, with hemoglobin below 10 grams per deciliter and ferritin below 10 micrograms per liter, and the patient is showing symptoms of iron deficiency anemia. But we need to be cautious when supplementing iron because it can worsen photosensitivity.
And Dr. Ross, what about the psychological well-being?
Patients should receive routine anxiety and depression screening. This is a tough disease. As for pregnant patients, continue routine prenatal care. There's no special monitoring required for EPP patients who are wishing to conceive or become pregnant.
So let's also talk about liver monitoring in EPP. Dr. Wang, what's the approach if liver function is normal?
Right. So for maintaining liver health, some things to be careful of. One, maintaining a healthy weight, primarily to avoid the development of non-alcoholic fatty liver disease. Limit alcohol intake, which can damage the liver. Getting vaccinated against hepatitis A and B, which again can cause hepatitis. Avoiding hepatotoxins, low dose, low estrogen oral contraceptives, and then checking annually liver biochemistries to screen for liver abnormalities.
And if there's evidence of dysfunction, what should happen next?
Right. So then baseline liver biochemistries and abdominal ultrasound are recommended to take a look at the liver, and then repeat testing every 6 months or more often if needed to more closely monitor.
And what specifically should be checked during monitoring?
Right. So liver biochemistries, CBC, clotting time, and protoporphyrin IX levels. Remember, we are still unable to predict the risk of hepatic complications at this time.
Now, we mentioned that EPP is tough and that psychosocial support is vital. Dr. Ross, what resources do you emphasize?
Firstly, the patient advocacy groups are very, very helpful. The shared experience really helps to combat isolation. Social media and meetings are vital connections. Second, accommodations for school and work are really important to make sure these patients get maximum benefit for quality of life.
And what about for pediatric patients?
Education is key here. Teach them about EPP so they can understand their needs and help them advocate for light avoidance.
And is there any specific advice on talking to schools?
I think we need to be proactive if possible. We need to provide the teachers with materials on EPP and be available if they have questions.
And patient counseling is also key. This slide distills the essentials. So, Dr. Ross, you just emphasized the importance of sun protection and yearly monitoring. Dr. Wang, how do you handle patient anxiety around monitoring?
So we acknowledge our patients' concerns and explain why we monitor, not just what we're monitoring. Patients oftentimes describe their EPP as invisible, making psychosocial support vital. It can also be helpful to connect patients to resources such as advocacy groups and expert centers.
And remember to counsel on treatment options and the option of clinical trials which may be recruiting.
How do you manage patient expectations?
Well, it's important to acknowledge the challenges, but emphasize that the research space is very active and offers supportive care.
Dr. Wang, you're an active member of APEX. Can you tell us a bit more about it?
Yeah, APEX is a program that provides easy access to porphyria experts. It helps clinicians navigate guidelines and it offers up to date medical information for both clinicians and patients.
And how else does APEX help?
Well, crucial peer to peer consults are available. Do not hesitate to get a porphyria expert involved. This resource is invaluable, especially for complex cases and for staying current on the latest developments in EPP.
Patient advocacy groups can make a significant difference for patients and their families in navigating the challenges of living with EPP. There are several prominent advocacy organisations that exist for patients with EPP and their families. The UPA is dedicated to supporting individuals and their families affected by all types of porphyria. Shadow Jumpers assists and connects families in North America with rare photosensitive conditions, including EPP. The American Porphyria Foundation, APF, is a well-established organisation providing a wide range of resources and support services. Lastly, there's APEX, which we just discussed.
And with that, we will wrap up this third and final session of this series. But before we conclude, let's take a minute to review some of the key takeaways. Dr. Ross, let's start with you.
The current consensus guidelines are available for the diagnosis and management of EPP.
Management strategies following EPP diagnosis include lifestyle adaptations, self-management, and yearly monitoring of PP9 levels, CBC, liver biochemistries, and vitamin D and iron levels.
Sun protection strategies include sunlight avoidance, wearing opaque clothing, broad spectrum or tinted sunscreens, and window tinting for cars. Additional counsel is available through various resources, as well as opportunities for peer-to-peer consultations with a porphyria expert.
And that will conclude our video series. Thank you all for joining us for this three-part program. A very special thanks to Dr. Bruce Wang and Dr. Gail Ross for sharing their invaluable insights and expertise on EPP. And don't forget to tune in to the other chapters in this video series. We'd also like to thank Disc Medicine for their sponsorship of these informative sessions. We hope to see you again real soon on MedLive Rare.